All right, well, thank you everyone for joining us today. I'm excited to host Healthcare Happenings, an interactive discussion to share stories of how these two ladies have helped their organizations to uplift and recognize their employees during some critical times. My name is Theresa Harkins-Schulz. There we go. I'm the SVP of Customer Service at Inspire Us. I've been a long-standing board member. Won't even tell you how long, but I've been involved in the association for a very long time, involved in education, and just continuing to play out and help organizations understand how recognition can help drive their business goals, drive engagement within their organizations, and ultimately make a difference in the lives of the people that they serve. I am thrilled today to have two competing organizations here. I had a hard time as I was pulling together their slides for the presentation to decide, well, who goes first? Is it Michigan or is it Ohio? So I went with the alphabet, stuck with the M first being before the O. So I am pleased to have these two rival organizations and research hospital medical systems with us to share their expertise. I am joined today by JoAnn Grantham, who is Michigan's Medicine Recognition Program Manager for the University of Michigan Medicine. She manages their recognition initiatives for over 29,000 employees and faculty. And then I'm also joined by Amy Hurley. Amy is part of the RPI board. She is recently been our past president. And she is the program director for faculty and staff recognition at The Ohio State University Wexner Medical Center in Columbus. One thing to note there, it was just recently announced. I want to say congratulations to Amy and her work at the Ohio State University Wexner Medical Center. They have just been awarded the 2020 Best Practice Overall winner. So what a great accomplishment. There are 7 best practice standards that her organization met, from recognition strategy to management responsibility to measurement to communications to training to program design and continuous improvement in all of those, and not last but least, events. So those are the 7 standards, and they exemplify all 7 of those. So I'm thrilled to have both of these ladies with us today. And they are going to share some information with us. So first up, I'm going to facilitate with some questions. If you have specific questions or things that you would like to know more about, there is the chat feature. Feel free to put those in there. But we all know that, you know, since March here in the United States, COVID-19 has really disrupted our world. Not just our workplaces, but it's disrupted our families, our schools. We've had as of today, over 2 million cases here in the United States, 115,000 deaths. And this has made us rethink everything about how we work, to how we interact with people, to who are the essential workers in our workforce. I don't know about you, but over the last couple of months, it's really made me rethink those essentials and just show an extra level of appreciation for people that are in the grocery store, those clerks that are stocking those shelves, ensuring that we have food and goods for us, as well as those truckers delivering supplies, the trash people picking up, you know, trash throughout this time. But ultimately, our healthcare workers. Our healthcare workers have put themselves on the front lines against this disease and put themselves at risk, have had to go to extraordinary lengths to ensure that they can protect themselves and protect those that are in their hospital systems. So what I wanted to start off with today is to ask Amy and JoAnn to tell us a little bit about what a day is like for a frontline healthcare worker right now. And what has that felt like over the last several months for those individuals?
I can go first, Amy, if you don't mind. So, like Theresa said, I work for Michigan Medicine, but so does my husband. He is a frontline worker. He works for support services for the health system. So I really had a firsthand look on what it's like. You do feel connected. You do feel like you're part of the big picture as far as helping the community navigate this awful pandemic that we were in. But at the same time, you have certain stresses about being in the environment, not wanting to bring the disease home to your family, being very careful, not wanting to hug your family when you first get home, taking, your work clothes off outside or, in the garage so that, you don't contaminate your home. So there are certain mental stressors. I can speak probably for a lot of people at Michigan Medicine feeling very good about being connected and helping the community, being part of the larger picture, but there are those mental stressors that employees have.
The thing that I'll add to that are, you really addressed a lot of things for families, but our folks were working a lot of long hours, and many of the frontline workers were working with COVID patients, and that probably wasn't their primary job before March. So they had to do a lot of training and cross-training to be ready to be in roles and step into things that weren't necessarily something that they ever thought they would be in. And that's, nurses and physicians, but it's also the case managers, it's people who were delivering meals and people who were doing transport. The environmental service workers, a lot of them were in situations that they had never been in before. So there's a lot of stress for these people. And they were also in an environment where they were losing a lot of people. Whereas in a normal day, we work in a hospital system. People who do clinical care are going to get used to loss, but this was a lot, multiple losses. And so having resources in place for those people dealing with the kind of masses they were dealing with was really important too.
You're on mute, Teresa.
Sorry, I was trying to sit still, which isn't one of my strong suits. I think all of us can relate and have heard, what it's like for the healthcare workers and the extra stress and the long hours that they've dealt with. What were as you started to go into this unknown pandemic and really understand, there was a lot of uncertainty as we think back, into February, into March, as to how to handle this and what to do. What were some of the strategies that you guys used within your organizations to think about the people and how to deal with what was happening with COVID?
Want me to go first this time?
Yeah, go ahead,
Okay.
Amy.
Well, I know our organization, first of all, put together a lot of cross-functional disciplinary groups. And it was on everything as far as about the screening stations, the call centers, redeployment, because a lot of outpatient closed. So what were we going to do with those folks? I had, I'll say the honor, because I feel like anything we could do to support these people was an honor, of being involved with the well-being of our staff group. I helped with food delivery. I helped with a grief group for dealing with losing our own staff members. And then the recognition group. So we put together all of these kind of groups to have kind of an immediate response to creating communications, using a lot of creativity. And I think later I'll get into what we did with the recognition group, but putting together some really good tools that even beyond this, whenever beyond this is, we're going to be able to have some really good tools in place for the grief piece or some of the well-being for our staff. I hope some of these things stick. They've been awesome supports.
Yeah, some of the same things that Amy said were implemented at Michigan Medicine. We had what's called a command center and an employee response team. That team really, like Amy said, met the different needs of employees, whether it was And I'll talk about a little bit later too what some of the things that went on, but personal, mental well-being, those sorts of things, meeting those needs. We had to redeploy staff as well. So a team was set up for that. Immediately we set up COVID emails that went out daily to all of our constituents. We had town hall meetings once a week where leadership kind of briefed on the different areas of what was going on. Because like you said, you have to redeploy staff. We set up a field hospital in the event that our own facility became at capacity or above, and so that we could, like a lot of states did, so we can meet the needs of the influx of people that coming in. So I think everyone just rallied together across all disciplines, kind of worked together to make sure we can move forward and that our employees and faculty were supported.
Excellent, excellent. Can you share some successful things that you have done, or things that have worked well within your organization to help recognize the efforts, keep these people motivated throughout this time frame?
So I'll go first this time, Amy. So really, the biggest thing that sticks out is how the community, and I'm sure Amy can attest, kind of rallied around healthcare systems across Michigan, and including our own, donating over 19,000 meals to frontline staff. We had mental health services, but the community partnerships have been very great, even going past the initial crux. Now that we're flattening a little bit, going past that and having a hardship fund for those that are affected by it. But a good partnership, I want to say, is our communications department. So I think communications has been key in keeping people motivated, whether it was a campaign that we did, Held to the Frontline Staff, because we're held to the victors is our slogan, where we allow people to kind of submit pictures to our social media platforms, just honoring. There were parades from first responders around the hospital, kind of rallying around some of what you see in New York. But just, the community support and communication has been very key. So we were able to highlight those different facets, not just nurses, but also support staff, environmental services, call center, those who were really kind of contributing as a whole. I think using communications was really the key factor with the daily updates, that sort of thing. So those are some of the things we have done.
Yeah, I would agree. The community partnerships were amazing. Mm-hmm. The outpour of food, same thing with meals, and even just putting that infrastructure in place to be able to deliver the kind of meals to people, was quite the undertaking. And people just rose to the occasion to figure out how it would be done. We had, you don't think about these kind of things, but we had an organization that usually does the fundraising chocolate bars for all the schools. Well, the schools weren't doing those kind of things. So they call us and they're like, hey, do you think you could take 16,000 candy bars? Okay. We just had these kind of things. We had flowers donated. We had all of these things. And one of the things that I thought was really interesting was you kind of heard about that COVID-19, like the college 15. So a lot of our staff were starting to say things like, the food's great. It is great, thank you. But they started saying, and you've all seen these stories on the news, but people wearing these masks, they had chafed, they were just raw. And so they started asking us about face wipes. And with the N95 masks, we had a way to get them cleaned. They could continue to use those. Ohio State worked with Battelle, and it was this amazing thing to be able to do that because supplies were low. So they could not wear chapstick, they could not wear makeup, they could not wear lotion, any of these kind of things. So once again, it was just a rough surface. And so we put together care packages of Gold Bond powder and chapstick for when they got off, all of those kind of things, listening to our people to really what would make their experience a little better. So.
Teresa, you're muted.
Yeah, do one of you guys, do you want to go through some of the pictures that you put together?
Sure.
Okay. You want to start? Oh, let me hit share again. There we go. Okay. And we're on. There we go.
So this is what I was speaking to, the Hail to the Front Line. So people submitted with the tagline, the hashtag, pictures, whether in our community or our own, peer-to-peer recognition, just submitted to communication. So these were posted on our screens around the institution, on our social media platforms. So there was a constant appreciation because you can't have events, you can't have, some of the other things. So this was a way to really appreciate what was going on. Same thing, writing on the sidewalk outside, but the Hail to the Front Line. You can go to the next one, Teresa. Someone from the community put this outside. So that's kind of our view from our main campus from the hill, our hospitals. So when you ride by, and I work off site, but I've ridden by, I went to the hospital to do meals on an occasion. And so, it's just good to see that. So this was we asked for donations, our employee response team. When you're working those long hours, when you can't get to the grocery store during normal hours, we all experience the shortages of very essential things like toilet paper and cleaner. So we had people donate, and this was for care packages. So if I needed some as an employee, I can go here and get some of the things I need to kind of take that load off. People still have families and lives, so they needed some of these supplies. So this is what we did for them.
Yeah, that's great. I think, it's one of the things we take for granted is being able to do the things that are part of our daily life, right?
Right.
Feed our families, have dinner, for them. And these healthcare workers have already put in, their time and they can't get to the store. And it's great that you were able to pull those things together so that they would have that option to pick those up.
Absolutely.
All right, Amy, I think I've got I've got one more Michigan one here coming up. There we go.
Oh, this is our main hallway, overlooks our courtyard. And so people wrote messages on the windows. We put pins out there so people could our staff was inundated with messages. One day my husband came home with a care package with a water, a granola bar, just to kind of rejuvenate himself, and a towel with our logo on it, just little packages. So every day they were reminded of how much they appreciated.
Yeah.
And our first responders did a parade around our institution to thank the people on the front line.
Yeah, that's great. I think the car parades have become very popular these days. I don't know if you guys have seen the meme that's out there that 20 years from now somebody hears a honk and they turn around and say, whose birthday is it?
Yes.
So it's like reconditioning us that's what that means in the world. But it's great to see communities rallying around to encourage and appreciate each other in those efforts. So switching gears, let's take a look at the Ohio State University.
And it's really interesting to see how many of our things are so similar.
Mm-hmm.
Very early on, we had this semi-trailer available to us. So we put messaging on it and then put it around the inner belt so people could see it at different parts of the community, and then parked it in front of some of our facilities. And, it's not only there, it's not only a positive message, but you couldn't believe the amount of people, our frontline workers, going out there to have pictures in front of this, that they were proud to have their pictures with this. And they were proud that the organization was saying thank you to them. So I don't think that could be said enough.
Yeah.
Oh yeah. So we always have Dr. Brutus. Brutus Buckeye is our mascot. And we had Dr. Brutus, and we had a lot of people making their own masks to make sure he was compliant. So that was just a fun one. This is just to deal with a lot of our meals. What we did was to thank the community back. We made these 6-word signs. And we had a lot of different messages, but we made sure to take pictures of our staff with these signs. And then with the help of our advancement office, we sent the pictures back to all of these great restaurants and places that provided so much nourishment to our faculty and staff.
That's awesome, because a lot of the restaurant industry is obviously hurting as well. And, you know, for them to be participating and helping out in the healthcare community, that gives them, you know, something that they can publicize and use in their communications out into the world.
Yeah. We did a lot with signage as well. So we had all of these signs on sidewalks at all of the entrances at facilities, and there was a lot of different messages, so it wasn't just one of them, but people really did like seeing these positive messages. And these are some of the snack bags. So we had bags with, you know, you can see some of the Oreos and candy bars, but we also were inundated with thank you notes. And we had thank you notes from the community at large, from some of our own staff to different parts of the hospital, and then from the university. So what you see on top of here was the girls volleyball team all did signs and messages. So we just didn't know what to do with all of these coming in. So we started putting them into the bags that were going to all of the units so that we could share the love with all of the thank you messages.
Excellent.
And this just shows you how, like, some of the messages coming in, there were, you know, lots. So we also put a pile of these now neatly with all of the meal deliveries, because those were going to different places twice a day. So just to make sure that, once again, all of these different areas, and this might be a frontline clinical team, this might have been the pathologists, this could be the labs, but all of these different areas, and some of them are behind the scenes, but making sure that they got in their hands some of these thank you notes, that people in our community appreciate them.
Ooh.
We had some chalk art done as well, and we had these professionals come out, and as you can see, they are amazing. Wow. They were beautiful. Now, the first day they were there, at the midday, it started to rain, and we were freaking out thinking they're not even done. People aren't going to be able to, you know, take advantage of seeing these. And they're in a walkway that goes from a big bus line that brings people into the hospital, our faculty and staff. So our facilities guys went out and covered all of these in plastic to make sure that they would be great and ready to go and finish the next day. So once again, just the teamwork, everybody working together to make sure that our people felt that they were appreciated. We also worked with one of the Columbus Foundation groups, and they created these art cubes. So they were 8 foot by 8 foot, and they had a different artist did something on each side of these. And we did these at 2 of our locations. And the thought behind it was, if our staff people stopped, could take a look at it, and just have something else on their mind for a minute, it was worth it. And I think they succeeded. A very funny story, I guess funny, I'll say funny now. At the one on the right, the east side, we had a very strong storm come by. And that cube was like Dorothy's house. It went airborne and went across the street, but it wasn't damaged. So we put it in a safer place after that, but it was pretty interesting to hear, it flew away. So.
As if you didn't have enough to deal with already.
Exactly. One of the things that we did during all of this, I will say that we were very pleasantly surprised that our tools, the use of e-cards, the use of some of our random act of kindness, team awards, all of these kind of things, the usage actually went up throughout a lot of this time period. And along with that, we had developed a new booklet and some materials for managers. And we decided to go ahead and get these mailed to all of the managers right in the middle of all of this. Along with the cute little Brutus monitor strips. So they kind of were on the top of people's monitors to look over, and they say, have you recognized a coworker lately? So once again, it was just something to reinforce and give people ideas if there was something they needed. And this is a magnet, actually, like a big car magnet that we were able to create and give out to all the faculty and staff to put on their cars or their filing cabinets or wherever they choose to, their refrigerator, I don't know, wherever they choose to put it. We had those made and were able to distribute, you know, 5,200 pounds of magnets.
That's great. So if you were to, you know, kind of summarize maybe in one or two words, you know, what you've learned from this experience and, you know, the flexibility and agility that you had to demonstrate during this crisis, what would be your words of wisdom to, you know, another recognition practitioner who maybe is facing this kind of crisis, or maybe they're just facing their own crisis within their own organization? What would you say to them? What guidance or wisdom would you part with and share?
I think part of it is when you give people the power to make decisions and work together, maybe in a cross-disciplinary way where you're hearing information, you're hearing from people that you haven't worked with before. I think great things can happen quickly even. I don't know about JoAnn, our organization usually moves kind of slow, and things were given the green light quickly. People trusted people in making decisions, it seemed like more. And I think there were a lot of great successes because of all of that.
Same thing. Things move very slow normally, but this put people in a position where they had to kind of think on their feet. So if I can say some takeaways, collaborate with all your resources. I could not have delivered, or recognition couldn't be delivered with like communications or the wellness office, you know, so you need to collaborate and be very innovative and flexible. So I had to cancel a big event right in the middle of March because, you know, it wasn't conducive for what we were dealing with. And so now you have to be really quick to get on your feet and kind of put your feelings aside, and for the greater good, just kind of be innovative. How can we still make people feel appreciated and recognized? So you just have to really be very flexible. I've been more flexible and thinking outside the box more than I ever have in my career. So yes, now going forward, you know, we will have some things in place, and recognition, you know, broadening our horizons of what that means to people.
Good. So now as we, you know, start to move into, you know, it's not really post-COVID because we're still, you know, dealing with this, and we're going to be dealing with it for quite some time, but this is our reality of our world and our workforce and the way that we need to stay safe and to work today. So what kind of challenges are you facing as you think about your recognition programs in the year ahead? I know, JoAnn, you mentioned canceling an event. So what happens, you know, with that when you cancel a big event? How do you you know, come back from that or ensure those people get recognized?
So we're still in the middle of that. That was one event in March. I have another big event in August. Usually it's our Employee Appreciation Day, where we have vendors. It's like a big fair. And last year, I think we served ice cream to over 12,000 employees. We know post-COVID, that's not going to work out. So just an ideal and something we're planning with the Department of Communications is having a virtual Employee Appreciation Day where we offer some of the same things. We used to give chair massages out there. So maybe now doing a mindful meditation webinar instead, but having a whole day. And, you know, some ideas I got from RPI. You know, we had a similar thing last month like this, and I just listened, and I'm like, okay, well, let's take this thing virtual. What can we do? So offering some things that help employees, whether it's retirement planning class or professional development class, all in one day to kind of meet some of those needs that we would have done before, but in a different way, doing a cooking class. In our event last year, we had a chef demo outside and people just came and got samples. So now we'll have to take it online and do some healthy things to kind of combat the kind of COVID-19 that people have gained. So really thinking outside the box. So, you know, I came on this, but we're still learning, still developing. Our service awards programs had to be canceled because, you know, we're facing budget, probably like Amy, some furloughs, redeployment of staff. And so how can we still make people feel appreciated and recognized? So I've talked with our campus constituents about how we can still not have a service award banquet, but do something else in this place to kind of recognize. Do a whole communication campaign, honoring those people who have achieved 20, 30, 40 years of service. So really using the resources you can still recognize. You just have to be a little bit more creative and innovative how you do it.
I think one of the things we have supporting us is when you do an event for, you know, 12, 1,300 people, people, especially healthcare people, aren't going to want to go to that event anyways. So that we've had to cancel some things as well. We're struggling with what do you replace it with, and you're not going to replace it. You're going to do something, and you know, 2020 is going to be that weird year.
Yeah.
We're trying to do our excellence awards, which are kind of the highest awards usually given in May during hospital week. We're shooting for October. We don't know if that'll go forward yet. So we're trying, there's just been a lot of things that we're trying to do. Budget is going to be an issue. We heard today a figure about how much money our medical center lost just in this time period of potential income, because especially all surgeries, you know, unless it was an emergency, there was nothing else going on for quite a long time. And that's a reality. So we have to all be looking at what are some effective recognition things that we can continue to develop and support and get our managers involved. You know, I think that we're just kind of the creators and the helpers of these things. It's really up to our people to buy into it and use them to make them effective. So we're constantly looking at what's the best ways to communicate that, to show that, to guide people, and you know, hopefully things will continue on that way, because I think the appreciation is actually up right now.
Yes.
People, you know, and I hope that continues as we are getting ready to go through Appreciation Week as well, and just making sure that people know, and we continue to talk about, like we know with RPI and talking to different, looking at different surveys, we know that those words of appreciation mean more than that coffee mug. They mean more than that raise to some people. Knowing you're appreciated, knowing people value the job you're doing is the most important thing. So Absolutely. How do we continue? And, you know, I look at all of our people who were redeployed. We have people who were, you know, an outpatient occupational therapist, and they were working in a supply chain, you know, with people who'd never done that before. And they were amazing, you know? So, just that flexibility and knowing that they were doing it for the organization. How do we make sure that they know the appreciation that we have?
Yeah. Did either of you in your organizations, did you do any employee pulse surveys or, mini engagement surveys throughout this? And then the second question to that one is there anything that you use to measure the success of the communication campaigns, like how well informed your employees are and things like that? What kind of measurements do you have? Can you talk about those for a minute?
Yep. So we have an employee engagement survey every year, probably about March, and it was decided to kind of put that on hold because people's thoughts and emotions were all over the place. So we kind of put that on hold. We relied on our leaders to kind of check in on a regular basis with their staff. But to measure communication, so we have a daily newsletter that goes out digitally. So Department of Communications, when I post a lot of things or do, shout outs, I asked them what was the readership. They're able to measure the click-throughs for that. An institution our size, we don't even have a recognition platform yet. We are getting one. That was one thing that stayed in the budget, which I'm so glad for, because now, now they see the importance of having one. I've been kind of beating my drum for years. So once we get that on board, we'll be able to measure success that way as well. We're in the midst of developing it and launching it in the next couple months. But the click-through on the readerships, our Department of Communications is very good about giving the success of certain stories or certain things that we've done.
Great, that's really encouraging to hear. What about you, Amy?
Yeah, so we were able to look on our platform, and so the sending of e-cards was up something like 37%. And I was worried talking to Caitlin, my coworker, going, oh my gosh, I wonder if the usage of tools is going to go down because people were so busy or people were off site and everything. And we saw the e-card rates go up. We saw people using our internal social media outlet more and posting pictures and talking about the gratitude more. And that was amazing. The communications, our communications department, we had a daily email from our chancellor, and thank goodness he's there. He has a warming just aura, so he had good words to talk about. Also, every day, recognition sent. I'll give Caitlin Ham the credit. Every day she sent from our email the thank yous that came in from our own staff, from the community, and from OSU. We sent those in, and every day in the chancellor's email were recognition. That was a part of every email every day, was
Great.
just those positive notes.
That's good.
So those kind of things were just amazing. And we're still seeing that. We're seeing a lot more team awards come in right now.
Yeah.
And we're seeing still, we do something, sometimes at our facility, there's things that really didn't meet the criteria for an award, like a personal individual award. But we know that what they did was amazing, that thing. So we created just really simply something called a random act of kindness. And we just give a little plaque that has a nice little saying on it. And we just say that thing you did that wasn't a part of your job was really great. And so we've seen a lot more uptick in the number of those being sent to us as well. So.
Good. So as the two of you are, in the recognition field, this is a part of your daily job. Where do you guys look for, inspiration, education, information? What kinds of things, and who do you lean on when you need to be boosted up and motivated to do your daily jobs?
A lot of these people right here.
Right.
Yeah. I think RPI is where I have really met the people that I email, call, and say, what do you guys do if this happens? How do you approach this? What does this look like for you for a day-to-day tool? I think this is just the best place for me.
I agree. We joked about being rivals in the sports arena, but through the years I have, asked Amy, okay, I think they're going to let me do a platform. What did you do? You know, who did you use? That sort of thing. So we ask each other questions all the time. So getting a network of, you know, recognition professionals are not common. So getting a network of people who do the things you do, reading, you know, on the internet, whatever, the tools that RPI has on the website have been very helpful to me.
Good. Good. Well, I've got one last screen to share here, just with some upcoming events for RPI. We do have another webinar next week that actually I'm hosting on the 5 trends that are shaping the employee experience. We have a virtual conference that's coming up in September, and we do have a special running on the CRP, which is the Certified Recognition Professional designation. So those are educational classes that you can learn about the framework and the foundation on how to build your recognition programs in the organization. So I want to thank Amy and JoAnn and Recognition Professionals International for allowing us to host this today. I think, you know, as I listened to the two of you talk, I heard a couple of key messages, you know, that I walk away from this with. And one is that collaboration is key, getting people involved, ensuring that people have a sense of purpose and something visible that they can connect to within their organization. You guys had a lot of visible symbols out there that were daily reminders, whether it was a reminder that I'm connected to this purpose and doing something good, or it served as a way for me to have a mental break and step away from that. But those visible signs were really important in the workplace. And then lastly, just having the ability to be flexible, listen to what the needs of your organization are and respond to those as quickly as possible, whether it's through, you know, the snack purchases or you know, recognition activity and acknowledging the efforts of others through, you know, instant awards that may be created. So we thank you both for your efforts, your time, and your expertise to share with this group today.
Thank you.
Thank you for having us. I want to know, are there questions out there? I saw one that we answered, but any other questions in the chat from people or things that they want to share that they're doing in their own organization?
Great. Feel free to unmute yourself if there's something that you're doing or that you've heard about that you might want to share, or if you have a question that you want to type in, we can take those in here too.
So one of the things I'll share is we too had to cancel events the day before the event. That was fantastic.
Is this Gail?
It is, yeah.
I can,
Sorry, my video was working and then it went off, and anyway, so here I am. Anyway, so we had to cancel events, and we have come up with a way that we're just hoping to get the blessing from our CEO on, is that we're going to do a video for our long service. We held luncheons before, and they got a picture with the CEO, and they got their certificate and pen handed to them. And of course, we cannot do that now. And so we are going to test run video messages from our senior leadership going out to them. We'll let them know that they're going to receive their stuff in the mail. It's not ideal, acknowledging that it's not ideal, but this is what we want to do because we don't want it to go out any further. So we're hoping to hear a lot of people, their feedback is they understand and they're encouraging. And we also at this time, just May 1st, we launched our new long service platform, and our new strategy has launched, and our new e-cards have launched. So there's a whole bunch of things that have happened during this, and also half of our department was redeployed. So it's been a very interesting time, but the acknowledgement and the understanding from our staff that, you know, are like, okay, so we're getting a lot less now for long service, or, you know, all these different things. It has been very well received. We're never going to please everybody, but it's certainly been well received and understanding. So yeah, those are just a few of the things that we have been trying to do, trying to figure out how to get virtual recognition being meaningful.
Absolutely.
And you know what, we're struggling with that, with also hearing about, you know, virtual fatigue. You know, there's a struggle right now with, I can say personally, on Friday, the last meeting of the day, people are like, turn on your video. And I'm like, no, you know, you just about had it. So we're struggling with, if we do something virtual, will people find value in it? And I don't know the right answer, but it's, once again, it's that balance. And I think the best thing to do in any of those things is get people's opinions. Don't create things in that vacuum, but go out and get quite a few different kinds of people's opinions about it.
Well, and one of the things that we looked at with the video message is we had thought about a Zoom meeting or something like that. But the people that we're targeting have 50 and 55 years. How comfortable are they on our video? I mean, some of them maybe, but the majority of them are probably not. So we had to figure out a different way to work with that.
I like that idea.
That's a good idea. Our service award program is the entire campus. So Michigan Medicine itself is 29,000, but the whole university is over 40. So, you know, brainstorming ways to honor service awards. We talked about doing one of the parades, you know, where leadership will be out there waving. You just have to be creative. You know, we're still vetting that. So like Amy said, I'm going to poll some of our awardees this year to see what will be meaningful to them, and then go forth with our planning. So whether it's an online chat, you know, a Zoom where we put people in rooms with 30 years of service so they can talk about each other and 40 years of service. So you just got to be innovative. So like I said, I'm in the middle of it, and, you know, we're exploring all options to make sure it's meaningful.
I think the key is to ensure that you still do something, right? If you do nothing, that is what will always be remembered. Something will always have an impact over nothing. And I think that's the important. It may not be perfect. It may not be everything that it used to be, but for the environment that we're in, it's appropriate. And, you know, people do, I think one of you used the word understand, you know, they're understanding of the situation where they're at. And that's just an element of it. But it's important to make sure that we do take the time, you know, to acknowledge workers and their efforts, even if it is, you know, a quick note or, you know, something via Zoom. Ensuring that they're at least acknowledged for those efforts is really important. Anybody else have anything to throw in here? All right, well, again, thank you for your time. We hope maybe you can join us next week to talk about employee experience. If not, check out recognition.org. The website does have a number of tools and resources that you can use, as well as webinars that can be played back. So we encourage you to check those out. And be sure to tap into your networks and your resource of individuals and others that are facing the same challenges, because sometimes they can just give you that little spark of motivation to get you over the hump. So everyone have a great day, and thank you again for your time.
Bye.
Thank you. Thank you all.
Bye.